A new study out of UBC is looking at the use of contraception in BC after the provincial government began covering the cost of prescription birth control in 2023. That study shows a jump in birth control prescriptions overall, but also reveals that users opted for longer-lasting options that come with more costs up front over cheaper but shorter-acting options. That study's lead author is here with us now. Laura Schummers is an assistant professor at UBC in the Faculty of Pharmaceutical Sciences. Thank you for joining us. Appreciate it.
Thanks so much for having me. It's great to be here.
So out of this study, what are people opting for?
Yeah, so what we found is that for the most part, the policy led to an increase in the use of what we call long-acting reversible contraception. And that includes both intrauterine contraceptive devices, or IUDs, as well as the newly available subdermal contraceptive implant.
Wow.
And these are these provide contraceptive coverage for at least 3 years and up to even 10 years, and are highly effective with less than 1% of users becoming pregnant in each year of use.
Interesting. And was there any particular reason you think why those who chose IUDs and longer lasting options did so over the cheaper but shorter acting options?
Well, what this study really showed us is that there were indeed cost-related barriers to contraception, and these cost-related barriers were driving contraceptive method selection among women and pregnancy-capable individuals across the province. So this tells us that those cost barriers were especially present for long-acting methods. These can cost up to $450 upfront, and for some people that is simply out of reach.
When it comes to the length of use of an IUD or another or subdermal device, how long can somebody use it for?
Yeah, they last for at least 3 years and up to even 10 or 12 years, depending on the specific device.
Wow. Okay. And in terms of what do you think this means for women and users of these devices?
So this tells us that we need to do, as a health system and health systems across Canada, a better job in providing unencumbered access to contraception. And we can see that BC's policy made great strides in improving access. If people didn't need this policy change, we would have seen no effect. But instead, this is telling us there was great unmet demand for contraception, and that unmet demand was especially concentrated in the most effective long-acting methods.
And when it comes to numbers of people who perhaps since the province started covering this, how many more people are using these devices?
Yeah, we found an increase of 14,000 users overall across BC, and most of those, about 80%, so 11,400, were new users of long-acting reversible contraception.
Overall, why do you think this kind of thing is important for the public to know and for you to study?
So within BC, this tells us that BC's policy change was important and worked. Across the country, this is important and timely as discussions about federal pharmacare and whether or not additional agreements between the federal government and provincial and territorial governments will indeed take place, so that this becomes a reality across Canada. This tells us it was needed in BC and worked. So we need to be sure that this kind of accessibility is available for people across Canada.
So this can be kind of a model, you think, for other provinces and other systems?
Yes, absolutely. When federal pharmacare was announced, in fact, we were told by the federal Minister of Health that we would be looking to BC to see how important and effective this policy change was. And now we have those results out today, and it tells us that, yes, this policy matters and pharmacare is important and should remain a provincial and federal priority.
All right. Laura Schummers, we appreciate your time and your expertise. Thanks for joining us.
Thanks for having me.